Case study 2-1, displaced fracture of the femoral neck. While walking home from the train station, M.A., a 72-year-old woman with osteoporosis, tripped over a broken curb and fell. In the emergency department, she was assessed for severe pain, swelling, and bruising of her left thigh. A radiograph showed a displaced left femoral neck fracture. M.A. was prepared for surgery and given a preoperative injection of an analgesic to relieve her pain. Inoperatively, she was given spinal anesthesia and positioned on an operating room table with her left hip elevated on a small pillow. Intravenous antibiotics were given before the incision. Her left hip is adducted, blood and fluid replacement, physical therapy, and vigilance for development of avascular necrosis and possible dislocation. Case study 2-1, intertrochanteric fracture. AR, age 88, slipped on wet grass and fell while gardening in his backyard. His neighbor was unable to help him to a standing position and called for an ambulance. AR had excruciating pain in his right leg, which was externally rotated, slightly shorter than his left leg, and adducted. Preoperative radiographs showed a non-displaced right intertrochanteric fracture. Inoperatively, Mr. R was given spinal anesthesia and positioned on an orthopedic table with his right hip adducted and secured in traction. He had an open reduction and internal fixation with a compression screw and side plate with screws. His post-operative recovery was unremarkable. Although he was at risk for deep vein thrombosis, that is blood clots in his legs, he was discharged to a rehabilitation facility for several weeks of physical therapy and assistance with activities of daily living, such as personal hygiene, dressing, eating, ambulating, and toileting. So the case study questions. Write a word from the case histories that means the same as each of the following. So replacement of half of the joint component is a hemiarthroplasty. Two substances that act against microorganisms is an antimicrobial. In a position away from the midline of the body is lateral position or an abduction position. Position towards the midline of the body is medial or adduction. Then identify and define the prefixes in the following words. So 5, displace and dislocate. The prefix is dis, and the prefix meaning is part, apart, away, or reverse. 6 is replacement and rehabilitation, which the prefix is re, meaning back, again, or contrary. 7 is avascular. The prefix is a, and it's without or lack of. 8 is anesthesia or analgesic, and an is without or lack of. 9 is orthopedic. The prefix is ortho, and that means straight, normal, or correct. 10 is externally. The prefix is ex, and that's out from. 11 is bipolar. The prefix is bi, which is two, twice, or double. And then 12 is unremarkable. The prefix is un, which means not, reversal of action. And then fill in the blank. 13, the adjective for the operative time span from decision for surgery to placement on operating room table is preoperative. 14, the adjective for the operative time span from placement on the operating table until transferred to post anesthesia recovery unit or intensive care unit is intraoperative, and the adjective for the operative time span from admission to post anesthesia is postoperative.